Imagine walking through a crowded street, carrying groceries, thinking about dinner, thinking about nothing at all, and then, suddenly, something slams into your face. Not a bullet, not a knife, something so unusual that doctors would evacuate an entire hospital after seeing your X-ray. I'm Vale, and buried inside one woman's skull was an object that could kill everyone in the room. Welcome to SideFX Medical Mysteries, where medicine meets the unexplained.
On August 6, 2011, 32-year-old Carla Flores stepped out onto the streets of Culiacán, Mexico. It was supposed to be a completely normal day. Carla worked as a seafood vendor. Long hours, heavy trays, hot streets, the kind of exhausting routine where every day slowly blends into the next. That afternoon, Carla was carrying a tray of shrimp through a narrow alleyway near her stand. Traffic hummed nearby. Music echoed faintly through the street. Nothing seemed unusual, until suddenly, she heard a loud cracking sound, and then something smashed directly into the right side of her face. At first, Carla thought someone had thrown a rock. Instinctively, she reached up toward her cheek and immediately felt warm blood pouring through her fingers. Then her legs gave out beneath her. Witnesses nearby later said Carla collapsed almost instantly. Her mouth hung open awkwardly. The right side of her face looked destroyed, and embedded deep inside the wound was a strange dark object. One witness reportedly thought it looked like a stone. Another thought it was metal. Nobody realized the truth yet, but the next person to see Carla would unknowingly save her life. About 20 minutes later, a man rushed into Culiacán General Hospital carrying an unconscious woman covered in blood. The receptionist barely had time to react before the stranger shouted, "I found her in the street!" And then, before anyone could ask more questions, the man disappeared. To this day, nobody knows who he was. No name, no police statement, nothing. Which honestly feels slightly suspicious. But considering what happened next, the mystery of the stranger would become the least concerning part of this story. Because emergency physician Dr. Gustavo Mesa had just been called into Carla's room, and what he saw immediately disturbed him. Carla's injuries were catastrophic. The entire right side of her face was severely damaged. Teeth shattered, jaw partially displaced. Blood covered her neck and clothing. But what caught Dr. Mesa's attention was the object lodged inside her cheek. It wasn't jagged, it wasn't broken, and it didn't resemble typical bullet fragments. Instead, it appeared smooth, rounded, almost perfectly symmetrical. Natural objects usually don't look like that. Neither do most projectiles. Still, Dr. Mesa initially assumed it was debris, maybe shattered concrete, maybe road material, maybe some bizarre industrial fragment, but he needed imaging to know for certain. So Carla was rushed into radiology for X-rays, and moments later, the entire atmosphere inside the hospital changed. The second the scan appeared on the screen, the room went silent. Doctors stared at the image. Nobody spoke, because whatever was buried inside Carla's skull was clearly not a rock. The object had smooth oval contours, perfect edges, precise symmetry. It looked manufactured, deliberately manufactured. And suddenly, Dr. Mesa realized exactly what he might be looking at. He immediately ordered additional scans. A CAT scan was performed within minutes, and when those images appeared, Dr. Mesa reportedly ran to the nearest nurse's station and told staff to evacuate the emergency room. Not clear the hallway, not isolate the patient, evacuate everybody. Patients were rushed out of nearby rooms. Staff backed away from Carla's bed. Confused nurses demanded answers, but doctors already understood the danger, because buried inside Carla's face appeared to be a live explosive device, and not a small one. Dr. Mesa grabbed a hospital phone and called the military, which is generally not something you want your doctor doing during a routine emergency visit. Less than an hour later, soldiers arrived at the hospital, and after reviewing the scans, they confirmed the horrifying suspicion. The object inside Carla's skull was a live grenade. Somehow, a grenade had entered through Carla's cheek without detonating, and now doctors faced an impossible problem. Carla needed emergency surgery immediately, but if the grenade exploded during the procedure, everyone nearby could die, including Carla, including the surgeons, including nearby patients. Nobody knew how unstable the device was. Nobody knew whether the impact had damaged the trigger mechanism, and nobody knew whether movement alone could cause detonation. Suddenly, this wasn't just trauma surgery anymore. It was bomb disposal surgery, which is not exactly a standard hospital specialty. So the military made a decision. Carla would not be operated on inside the hospital. Instead, they moved her into an open field outside the city, a place where, if the grenade exploded, the blast radius would hopefully be contained. Doctors set up a makeshift surgical area in the grass. Soldiers established a perimeter nearby. And somehow, through all of this, Carla remained conscious. An anesthesiologist injected local anesthetic into her cheek. No dramatic operating room, no sterile surgical theater, just doctors, soldiers, and a live explosive lodged inside a woman's face. Carla later described hearing the clinking of surgical instruments beside her. She could hear soldiers giving instructions nearby. Every movement was slow, controlled, careful, because one mistake could instantly kill everyone standing around her. Imagine being fully awake while doctors attempt to remove a grenade from your skull. That level of stress alone probably deserves its own medical diagnosis. Finally, the surgeons began extracting the object, slowly, millimeter by millimeter, until at last, the device slid free. It was a live 40mm grenade, still armed, still capable of detonating. The device had entered through Carla's cheek and lodged deep inside her facial structure without exploding. Military personnel safely secured the grenade moments later, and somehow, against all odds, Carla survived. But the mystery itself was far from over, because nobody could explain how this happened. Investigators never identified who fired the grenade. They never confirmed whether Carla was the intended target or simply an innocent bystander standing in the wrong place at the wrong time. No clear motive was ever publicly established, and the stranger who rescued Carla from the street was never found. Almost as if he appeared, just long enough to keep her alive. Carla would ultimately lose several teeth. She underwent multiple reconstructive surgeries, and she was left with permanent scarring along the right side of her face. But she survived something that should have killed her instantly, not because of luck alone, but because doctors, nurses, and soldiers were willing to stand beside a live grenade to save a stranger. Medicine is filled with strange injuries, rare diseases, unexplained conditions. But occasionally, doctors encounter something so bizarre that science briefly collides with pure disbelief. And somewhere in Mexico, there is still an unanswered question lingering quietly in the dark. Who fired the grenade, and why didn't it explode?
The investigation continues. Review the next case.